Hello, welcome to the AHRMM webinar. I would like to now turn the floor over to Mike Schiller.
Great, thank you. Welcome everybody, and thank you for joining us today for Shaping the Healthcare Field, the ISM Hospital Report on Business. The presentation handout was emailed to you this morning, but you can also access it through your media library located on the upper right-hand side of your page. Click the square icon with the play triangle, then double-click on the handout. Please complete the survey after today's webinar, as this helps us here at AHRMM to continue to deliver relevant educational content for you and other healthcare supply chain professionals. You will receive your continuing education certificate about 2 weeks after you complete the survey. You may have seen or know about the ISM Report on Business, one of the most reliable economic measurements in the nation today. AHRMM, the Institute for Strategic Management, and the Strategic Marketplace Initiative are all working together to develop a similar economic index for the healthcare supply chain. Today we will learn about this important initiative and how you can work together and contribute in the important work that we are doing on this project. This report will help identify trends and assist supply chain leaders in making important business decisions. I'd like to introduce today's speaker, Tom Derry. Tom is the Chief Executive Officer of ISM with more than 30 years of experience in leadership and general management roles for public and private companies in the not-for-profit sector. You may have seen Tom. He's been interviewed on CNBC, Bloomberg Television. He's been quoted in the Wall Street Journal and in the New York Times, as well as dozens of other business publications. Tom has represented ISM in meetings with the White House Council of Economic Advisors, the National Security Council, the Federal Reserve System Board of Governors, and the U.S. Small Business Administration. Tom, thank you for your time today, and I'd like to turn the floor over to you.
Well, Mike, it's a pleasure to be here with this audience from AHRMM and the American Hospital Association generally, and delighted to be discussing this very important initiative. As you and I have talked, Mike, in the past, we think this is a very important development for the industry overall, for the healthcare industry overall, and then for the U.S. economy at large. And I think that I'll touch on some points during this morning's conversation that will help connect the dots for our audience to understand why we think this new measurement of supply chain activity in the hospital industry specifically right now, and more broadly the healthcare industry a little later on, is critical to making more fine-tuned business decisions for those who are involved in running hospital supply chains and running hospitals generally, but also policymakers and regulators concerned with larger policy questions concerning the healthcare setting, and even macroeconomic considerations. We know there's been a lot going on and not going on at the same time in Congress, for instance. So ISM is 102 years old. We are the oldest and largest supply management organization in the world, and we've been doing the report on business for more than 8 decades in the manufacturing sector and for more than 3 decades in the services sector of the U.S. economy. We have more than 50,000 members worldwide, and the data that we collect comes from our membership. Moving to the next slide, just want to give you an indication of the following that we've generated over the years. One of the reasons that the data is so widely followed and is so influential is that we've got decades of trends. So people who are concerned about modeling trends and understanding the relationship between performance today versus performance in the past, they need these long trend studies to be able to understand the accuracy over a period of time of the data. You can see that in this particular example, very, very common for us. We're cited in the Wall Street Journal every month. There's another little screenshot from Bloomberg. We're covered in CNBC and the Financial Times and industry publications and virtually in a fairly ubiquitous way on the first business day of the month when the manufacturing report comes out, which was just earlier this week, and on the third business day of the month when the services sector report comes out, which will be tomorrow, as a matter of fact. And it turns out that the data is market moving because it's the most reliable and closest to real-time economic data that's available for the U.S. economy. And that means that the data is seen as being really representing the pulse of what's happening in the U.S. economy at any moment in time. When you think about what we do in the supply management field, we're trying to understand the downstream demand that we're trying to satisfy with our customers, or in this case, healthcare question, our patients. And we're creating the upstream demand with our suppliers, and our job is to balance those supply and demand curves. And that's why the data that we publish is so widely followed. It indicates exactly what's happening at that point in time in the U.S. economy. In fact, we have a very good track record of correlating to changes in U.S. GDP, changes in inflation rates, and I can explain a little bit more about that in just a moment. So moving to the next slide, I just wanted to ask the audience, how many of you are aware of the ISM Report on Business, either the manufacturing or the non-manufacturing report? Have you seen coverage of it in the mainstream media, the news media over time? Curious to know how widely known it is in the specific sector. And right now it looks like, yeah, okay, about what I would expect. About 4 in 10 of you, or about 40% of you, say, yeah, you're aware of the report, and I'm sure that explains why you're dialing in and you're eager to hear how it might apply specifically to the healthcare setting. And I hope to be able to answer your questions today. And for those of you who are just learning about it, I hope that you come away from today understanding more about the existing reports on business and how they might help you in your current roles, but particularly this new report, which is in the field now. We have started collecting data. We won't be able to release it for some time because we need to validate that data before we go public with it. But I hope that you come away from today's discussion with a better understanding of why we think it's very important for you to participate in this critical initiative. Now this is a technical chart, but I'm going to walk you through it. This is the S&P 500. That dark line represents changes in the closing value of the S&P 500 and the stock market over a period of about almost 2 years. And inside that red circle, there is a dot, which you can see, and maybe you can make out the date, which indicates that's June 27th of 2016. And you can see that dot is at the bottom of a very precipitous drop in the value of the S&P 500. For those of you who might recall, on June 23rd of 2016, the Brexit vote took place in England, and most of the world was shocked that the vote turned out the way it did. And in that referendum, a majority of UK citizens voted for England to leave the European Union. You can see what the reaction in the stock markets was in the United States immediately after learning the result of the referendum. Over the 4 succeeding days, the stock market here in the United States dropped rather dramatically as people speculated about the impact of that Brexit vote on the global economy, the local U.S. economy, certain industry sectors. I point this out because on July 1st of 2016, so 8 days after the referendum, ISM published the first official data that gauged businesses' actual reaction to the Brexit referendum and asked them specifically about the actual and anticipated impact and effect that the decision to leave the EU would have on their businesses. And their findings were a little counterintuitive at first. We found that most businesses felt that in the medium term, the impact would be negligible. And there are some reasons that make sense. You can, by analogy, apply it to your own role in healthcare. Your relationships with your suppliers is typically fairly durable, managed by contract, and those relationships can't be, easily undone in the blink of an eye. And there's time for people to think through the impact and effect of the decision to leave the European Union and to manage their business accordingly. So we published that first data, and the point of the slide is to show that it was the first actual data. It was not, there had been speculation in the press, but we had the first data out there, and the market was reassured and recovered. And you can see it resumed very quickly the general trend line that it had been on over the preceding few months. And so ISM is credited with putting data out there that reassured investors that in the medium term the impact was going to be not so severe, and that there was time for people to figure things out. That's a very real-world example of the kind of impact that the ISM data has today. So moving to the next slide, I'm going to kind of give you a little economic history, not too much, but to give you an indication why we have that kind of impact in the stock markets. So PMI, which at one time stood for the Purchasing Managers Index and now is just as PMI, extends back to 1923, so that's 84 years. And the NMI, the non-manufacturing series, or for the services sector of the economy, launched in 1998 when the U.S. Department of Commerce came to us and said, can you measure the services side of the economy, which today, by the way, represents about 88% of all U.S. economic activity. Manufacturing represents about 12% of U.S. economic activity. And healthcare obviously would fall predominantly in the services sector. And what you see in the chart on the right is the correlation between the PMI, which is that sort of olive green line, and the NMI, which is the blue line, and actual reported changes in GDP, which is the red line, over a more than 15-year period. And the key takeaway here is that we correlate very closely. In fact, statistically, for you mathematicians in the audience, the PMI correlates with a Pearson coefficient of about 0.71, and the NMI correlates with a Pearson coefficient of 0.88. It's extremely high correlations to actual movement in U.S. GDP. And these trends have held up over decades, and it's one reason why the data is so closely followed. So, for instance, the Bureau of Economic Analysis came out with its first estimate for third quarter GDP earlier this week, and it came in at 3.0% annualized growth. The problem is the third quarter has been over for some time, and they're going to revise that at least 2 more times before they settle on an official number. The value of the ISM Report on Business is that it gives you, in real time, an indication of the performance of GDP without having to wait, in some cases, 3 or 4 months for that number. Moving to the next slide, and this would be critically important, I think, for our audience. You can see that one of the sub-indexes that we measure is reported change in prices for the panelists on our survey. And you can see how closely actual inflation in the U.S. economy correlates to what's being reported as increases in prices paid or changes in prices paid by our survey respondents. This is very important for people who are concerned about the impact of inflation on the economy. And the correlation is even tighter than it is for U.S. GDP. Going to a very real-world example now for our audience. This is, again, a little bit of economic history, but it's specific to healthcare. This chart shows the change from the preceding quarter in real GDP for the U.S. economy. This is data that's reported by the U.S. Bureau of Economic Analysis. You can see, starting at the far left, that in 2013, especially in the second half of the year, the third quarter and the fourth quarter, we started to experience very strong GDP growth in the United States. So just over 3% in the third quarter, and very high number, 4%, in the fourth quarter of the year. So going into 2014, there was quite a lot of optimism about the underlying strength of the U.S. economy, and many of us were caught off guard when, in fact, we reported a contraction in economic activity for the first quarter of 2014. Many people were puzzled by that seemingly counterintuitive result. Now, it turns out that ISM reported on February 1st, which would have been for the January data collection period, that the economic indexes that we published were consistent with a contraction in the economy. And frankly, no one believed us because the economy had been growing so strongly in the previous 2 months. The same thing happened on March 1st for the February period. We said, listen, the economy, that indicates the economy was in contraction. People didn't tend to want to believe that until eventually the U.S. Commerce Department came out with its own numbers. I'm going to point out that what was happening, in addition to the underlying economic activity in the last 2 quarters of 2013, was the debut of the healthcare.gov website and the issues the government had with bringing that website online. And frankly, there was a lot of concern in the healthcare industry. The key provisions of the ACA were going into effect as of January 2014, including those healthcare exchanges I mentioned, mandatory coverage for pre-existing conditions, the availability of federal subsidies for those consumers who qualify. And it was quite clear that, in retrospect, the healthcare industry and hospitals in particular were unclear about how these massive changes in their environment were going to affect their business. So you go to the next slide for a moment. One person who was paying attention was Rick Santelli of CNBC. Maybe some of you have seen his program. And Rick called us up and said, hey, listen, we're seeing comments in your survey about healthcare, and we're seeing concerns about U.S. economic activity. Would you mind coming on my program? So we did. We went on the program, and Rick asked us a few questions, and it was quite clear that the sector, the healthcare sector in general, was reporting much more pessimistic outcomes in a view of the future than all the other sectors of the economy measured in that single report. And when you think about it in hindsight, this makes good sense. The U.S. healthcare industry represents a very high percentage of overall U.S. economic activity, and the signal going to decision makers in healthcare in late 2013 was, we're not certain what the impact of these key statutory and regulatory changes is going to be. Let's hold off on decisions like backfilling positions or hiring new positions. Let's hold off on investing in major capital equipment. Let's hold off on decisions to start that new construction project or that renovation project. And when you have 20% of the U.S., or almost 20% of the U.S. economy pumping the brakes, what happens? Well, you get the entire U.S. economy going into a 1% contraction. And I think that, in hindsight, that's exactly what explains what happened in January of 2014, and it's one of the key reasons why we think this report that we're talking about is so important to U.S. macroeconomic policy and to understanding specifically what's happening in the industry. As you all know better than I, there are many looming questions that are still unsettled about the future direction of healthcare in the United States. So I think I gave away this question, but let's get to the answer here. If you were paying attention, you already know the answer. What do you think the percentage is in terms of U.S. healthcare's contribution to U.S. GDP? There you go. Very good. Congratulations, you passed the quiz. Are any of you surprised that healthcare makes up such a large percentage of U.S. GDP? And that's the next question there. Oh, no, there's a wide understanding of the importance of healthcare to the overall U.S. economy. Well, that's really good, and I think that underscores, nearly 9 in 10 of you are not surprised about the impact of healthcare on the U.S. economy. And that indicates to me that you understand why a report like the one we're discussing could be so valuable to the industry and to the overall macroeconomic policy. Now, I'm going to explain just exactly what this index is. I'm not going to get very technical about it. I'm on slide 14 now. But what you need to know is that it's a diffusion index, and a diffusion index is a statistical method that allows the observer to understand the dispersion of an observation on a set of criteria or population. So it allows us to understand how widely spread the change is. And we measure this, it's actually deceptively simple. We simply ask for a series of questions, is the month-over-month change, and that's what we're asking respondents to. So here we are in, at the end of October when people were responding to the survey for the month of October, we're saying, was October the same as September? Was it better than September, or was it worse? And as you can see, the formula down here in the bottom right, you take all of the positive responses, so the percentage of people who said it was better, plus half of the same, and you add them together, and then you get a number. Generally speaking, any number over 50 indicates growth, and any number under 50 indicates contraction. And the higher the number above 50, the more widespread and the faster the positive change, and the further the number goes below 50, the more widespread and faster the change is moving in a negative direction. So the PMI, as an example, is actually a composite index which is calculated from those 5 subcomponents. What's happening to your new orders, what's happening to your production levels, what's your change in employment, what's the change in your experience of your supplier deliveries, or supplier deliveries slowing or coming in on time or speeding up, and what's your month-over-month change in inventories. And they're unweighted, so we just take the 5 individual diffusion index scores for those categories and mathematically average them, and that becomes the PMI. The same methodology, by the way, applies on the NMI side. Now, we've worked with a panel of industry experts, including Mike Schiller and other experts from hospital systems and individual hospitals and other experts in healthcare, to devise a set of questions that are similar so that we can begin to understand healthcare in relation to the overall U.S. economy, but also focus in and drill down on certain sets of unique insights that would be particularly of value to people making decisions about managing the hospital supply chain, the healthcare supply chain. Go to the next slide. I'm curious to know from the number of people in the audience right now, do you currently have access to these kinds of statistics with regard to your organization? Do you have access to the number of procedures that are scheduled, the headcount of new patients, to inventory levels within your organization, to the number of full-time equivalents or employees in the organization, and or the level of volume of healthcare delivered to new patients? And the answers are coming in. And this is really interesting, okay? So as we would expect, a large majority of you do have access to information about inventory levels. In fact, it looks like it's climbing well into the 60s and is still growing. That's not surprising. About 14% of you indicate that you have information about, oh, that's actually increasing a little bit, the level of volume of healthcare delivered. A relatively small portion, less than 10%, about 10% of you, the number of procedures scheduled. That's good. Only 3% say the headcount of new patients, and only 7% say the number of FTEs. I will point out that in the experience we've had with the current respondents, so we actually have this instrument in the field, and we are collecting this data from people like yourself, peers of yours in the industry, around the country, and we're analyzing that data to make sure that it's accurate and measures the things that we think it measures. And the response we've been receiving internally is that the survey is, in fact, living up to what we build it to be, which is it takes 10 to 15 minutes to complete once a month, and finding access to the kinds of data that we're asking about turned out to be relatively easy for your peers and colleagues. Yes, you probably had to go to HR to get some information about headcount, but once you establish that linkage, it becomes very routine and easy for the current respondents to gather and report on. Okay, let's go a little further. There's some key points for you as the audience to understand here. One is that right now we're focused on collecting data at the single facility level, meaning if you're a multi-facility hospital system, we're really interested in the data for, hospital A in the system. Now we'll collect data for hospital B too, but we're not trying to collect data at a corporate headquarters that looks across the entire hospital. That's an important part of the methodology because it turns out when you aggregate those insights at the individual unit level, they're more telling, and sometimes the data by the time it gets to the corporate level is a little less accurate. It's very important for everyone to understand, if you're interested in being part of this very important initiative, that we never disclose the identity of individuals who are responding to the data, nor their organizations. In fact, even though I'm the CEO of ISM, I do not know the identity of the panelists, nor do I know the identity of the organizations that respond. We know that the data can sometimes be considered sensitive and proprietary, and that we have a responsibility to protect the confidentiality of that data. In fact, we have robust IT systems to ensure that that data confidentiality is always maintained. One of the reasons that we've been so successful over the years is that people know that they can trust that the data will remain confidential. In fact, I was just meeting with Janet Yellen earlier in October 16th at the Federal Reserve, and with her and some of her senior staff economists, and they usually make the point, Tom, when we call companies from the Federal Reserve, no one will answer our questions or return our phone calls. I say, well, it's because you're the federal government. But when we ask people questions, we've had this track record of maintaining confidentiality, and people trust it. And they also, frankly, feel proud to participate in something that is so impactful, both on their industry and on the economy at large. And many of them, we have people who've participated for a decade or more because they feel so proud of their service. That's something that's so important. So I'm getting close to wrapping up and being able to take some questions from the audience, which I very much look forward to. Here's some things that you should know. So as I mentioned, participation is confidential. It does take 10 to 15 minutes a month, and we have your peers telling us that we've been keeping our promise on that. And it's a great opportunity for you to contribute your insights back. Think about your experience in a certain region of the country may be a little bit different from what is being reported in other regions of the country, for instance, and understanding why those differences exist and what to do about them can be important. So I think not only will you benefit the healthcare industry overall by participating, but by focusing on these kinds of questions, you'll develop insights that will help you manage your business in a little more finely tuned way. And as we know in healthcare, that's critical in today's payer environment. The way to participate is to email AHRMM at the email address listed here on the slide, and they will schedule a 15-minute onboarding call for those people who are interested to make sure that they can complete the survey. And that is maintained in total confidence. So no one at AHRMM and no one at ISM will know who's participating, but we'll be collecting the data and reporting it out. Now, I guess the question that might be on some people's minds is, when will we go public? And the answer is definitely no sooner than a year from now, and probably a little longer, because we need to observe the data over an extended period of time to understand seasonality and trends, and to make sure that when we go, because it will be so closely followed, that when we go public with it, that it's accurate and that people have a little bit of a trend line to work with. So with that, it's coming up just exactly on 30 minutes after the hour. I'm going to cease the presentation, and I'm looking forward to answering your questions. Mike?
Thanks so much, Tom. What a great presentation. A lot of good information. I felt like I was back in my economics class with Professor Tom Derry today. I appreciate that. I was wondering if we can go ahead and show the poll results. It was opened up, Tom, when the results were coming through and you were reporting those, the individuals, participants on our webinar, were only able to select one option. So they went ahead and made a change there so that multiple
yes.
options could be selected. So I just wanted to go ahead and point out, it's a significant change
You're right.
excuse
You're
me,
right.
in the results of the survey.
Well, that's very encouraging. It looks like a majority of you actually have access to really all of those questions. The one that seems to be, and it is climbing too, the one that seems to be most problematic right now is the level of volume of healthcare delivered. But otherwise, there seems to be nearly uniform access to all of those data points. That's very encouraging, and I think it's one of the reasons why our actual experience has been that it's been easy for people to participate in the survey.
So I don't know what the final number is on the participants in today's webinar, but so basically, Tom, I think we can assume that with this broad-based understanding of all of these factors here, we could see another 30 or 40 people join the survey participants.
We love it, and what's critically important for people to know is that the data becomes more and more reliable the larger the statistical sample. So it's important for us to continue to grow the number of respondents.
And to that point, I want to let folks know that we're moving into the Q&A session of the webinar, so please feel free to type in any questions that you've got within the Q&A box. And Tom, while we're waiting for folks to go ahead and type in their responses, I want to share one of the examples or stories that you shared with us. My gosh, we're about almost 2 years into this now, I want to say.
Yeah.
From just a discussion standpoint through all of the prep and planning that we've gone through, but the importance of this report again right now, the business report. And the fact that 5 minutes after you guys release this report, it's on the president's desk. And so the significance of the report, you've highlighted that very, very well, of course, throughout the course of the presentation. But I think it's important, too, for our audience to know that this report is on the president's desk minutes after after ISM releases this report.
That's right. So the Council of Economic Advisors for the president prepares a summary or a digest, one-page summary of the report, and it is on the president's desk literally within minutes of it becoming official. And the chairman of the council, who's the leader of the council, is preparing insights for the president of the United States on what does this mean about U.S. economic performance. And so this is, when I talk about real-time data, we collect the data typically in the last week of the month. We can turn around the analysis very quickly, and it's no more than a couple of days old by the time it's being disseminated to the public and to the United States president. And it is the finger on the pulse of what's happening in the U.S. economy. And we have, of course, we're proud of that influence, but we also understand that it comes with a great deal of responsibility. And one of the reasons why we're so careful in our methodology and also in protecting the data to make sure that it doesn't get out into the public domain before it's ready to be published.
Yeah, great, just a great analogy on the importance of this. And with the cost of healthcare becoming a larger and larger portion of our GDP, it is definitely a sector that is gaining importance and certainly talked about in the news quite often now. So this is a very timely report. Again, just want to remind folks, please type your questions in the survey box. I also want to reiterate the call for survey participants. It's extremely important, as Tom mentioned, that we build up the numbers of respondents. And Tom, I'm not sure if there's a target that ISM has in mind, but I know that, again, over the course of the next year, as we continue to host webinars and other presentations and getting the word out through various leadership channels to build that survey pool, if you will. Just wanted to know if there was a number that you are targeting here at ISM.
Yeah, well, I think we would be comfortable with a minimum of 150 participants, but in our other surveys, we're at a level that's significantly higher than that. And but of course, they've been around for quite a long time too. So that's what we're building toward. We're not quite there yet, and there's no such thing as too many participants. As I mentioned, the larger the sample size, the more statistically reliable the data is. So we don't turn people away. Now, in the other surveys, we do sometimes have more participation than we can actually use, and so occasionally we have a little bit of a waiting list. But we're not in that situation at all for this report, and the more the merrier, absolutely.
That's great. And data is so important. You talked about this report being the business report being the finger on the pulse of the U.S. economy, and as we are all well aware, the importance of data and data analytics, certainly from a healthcare perspective and much larger picture, looking at a macroeconomic perspective, it's equally important. So again, just want to encourage folks here, the point of this webinar was to bring you up to speed on this very, very important initiative, but also very important is the ask to participate in the survey. So Tom, a question I've got here, are there any requirements that ISM is looking for regarding panelists?
Not really. I mean, nothing that we haven't already touched on. It's the willingness or the ability of someone to say, yeah, I'm happy to walk down to the HR team and ask them about changes in employment in a month over month in my organization. And as long as you're willing to take that initial first step and establish the reports that have to flow to you to answer the simple survey, that's really it. We're not looking, we will have a variety of sizes of institutions represented. We'll have a variety of geographies represented. That's all good because this is a national report, and we want to represent the national point of view. Typically, someone needs to be ordinarily a manager level in the organization to begin to have access to that data, but that's not always the case. And it's more really about the willingness of someone to participate and say, you know what, it's worth 15 minutes a month to me to give back to the industry for my organization because we'll get some valuable insights from it. And as I point out when I talk about the use of the existing reports to companies, as I do around the globe, I urge them to assign an analyst in the organization to spend 2 hours once a month looking at the data as it's reported to glean insights for them. All right, it's interesting that I'm seeing contraction in this industry or growth in this industry, or that commodity is really important to me and it's reported being up in price 3 months in a row. What are my strategies around dealing with that commodity price increase? The same would be true for healthcare. When this report is out and established, I would expect people to spend a couple of hours every month looking at the data that's reported in it and the implications specifically for their organization, because you're going to have to adjust your strategies and your procedures to respond to the always changing economic environment.
And I think that's an important point, is the value of the data and how that data can then guide strategic business decisions within a hospital setting. And not only hospitals, Tom, but I would say that if we expand that influence to the supplier manufacturing community, and of course we've talked about the economics and the economist perspective, but it really becomes a very valuable tool that helps to guide the strategic decisions that supply chain professionals and other senior leaders in their organizations are making.
I'll give you an example that's coming up right now that probably is more relevant to the folks on this call than perhaps they realize, but we've been reporting pretty significant shortages in electronics components for the better part of 2017, in fact, for going back into 2016. And that includes products like capacitors and transistors and semiconductors. And the underlying reason seems to be this massive surge in demand as more and more consumer devices, but more and more everyday items are connected, right? Connected to the internet and to each other. And the reality is that capacity in those industries hasn't kept up with the massive surge in demand. Well, that's going to affect lead times for medical device manufacturers, right? And it's going to affect lead times for other products you're using in the healthcare supply chain. And understanding that all industries are competing for a relatively scarce and critical component is an important insight. And you might be thinking about, all right, well, how do we make sure that we're as least impacted as possible, in our case, or what are the critical areas where we absolutely cannot suffer a slowdown in supplier lead times. Those are the kinds of insights that will help you protect the business and help you protect the mission of delivering quality health care to your patients.
Absolutely. If you think about availability of product, if you think about a product that needs to be repaired, how quickly you can get product back online, and ultimately the impact on the patient, right? The patient's at the center of all of this.
Yeah.
So one final question here, Tom. You talked a little bit about systems versus individual hospitals. So let's say I'm associated or I work at a system, but I can give visibility, or I have visibility into the activity for my hospital, but it's only one hospital of a much larger hospital system. So in essence, I may not have system visibility, but I have visibility into the different questions within my hospital. Is that an issue when I'm taking the survey?
Not at all.
Or is there a concern with that?
That's actually terrific. We're happy to have data the individual facility level. And we can work with someone who maybe has a broader view and can report reliably on what's happening across a system or portions of a system. We would work with that individual to kind of narrow it down to where we think the data would be reliable. But no, we're happy to take. In fact, our experience has been that the data is more and more reliable as you get more granular in the reporting, because we can get our arms around, right, what's happening at my particular facility much more easily than we can get our arms around what's happening in a more broadly across a complex system.
Sure, especially if you think of systems that span multiple states.
Yeah.
So really, consistency then is what I'm hearing is the key. If I'm part of a system, but I can report on the metrics of my hospital, that I just continue to report those metrics month over month. I don't report my hospital 1 month and then I try and get system metrics for the next month and then maybe 3 hospitals the month after that. It's consistency that I'm reporting on the same metrics within the same boundaries, if you will, month over month.
That's exactly right, and that's one of the key ways in which we coach in our onboarding. It's as long as you're answering the questions in the same manner for the same scope each month. That's what we absolutely is the fundamental requirement. And shifting, your point of view, or that would make the data less reliable. So the consistency is a critical point. And I'm glad you raised it, Mike.
Right. Well, Tom, we're out of time here. I want to thank you so much for taking time out of your, no doubt, busy schedule and sharing the history of the Report on Business, certainly the important work that we're engaged in, and with the efforts of SMI on the hospital Report on Business. And I want to thank everybody for joining us today. Again, I just want to put a final call out there. Please carefully consider participating and being a survey respondent in this very, very important initiative. Again, the more respondents, the more statistically relevant the information becomes, and again, becomes a much more valuable tool for guiding all of us as we look to continue to make strategic business decisions day in and day out. Also, please let us know what you think of today's session by completing the survey. Again, you'll receive your CPE credits within about 2 weeks. So on behalf of AHRMM and Tom Derry and ISM and the rest of the groups here, really appreciate your time today. Have a great day, everybody. Bye-bye.